Good morning, friends. Everyone experiences anxiety in day to day situations, but anxiety, when it becomes out of proportion, it becomes intense, excessive, and persistent, we call it as an anxiety disorder. Simple things like overwork, giving any speech in public, or any kind of situations, loss, they can bring about a feeling of anxiety in a person. But if the anxiety is the person is able to control that anxiety and is able to overcome that anxiety, then it is a normal emotion. Anxiety word or anxiety is taken from a Latin word anxietas, which means choked up feeling. This anxiety in human beings can be presented, or it can come up as three things like generalized anxiety disorder, OCD, and specific phobias or fears. So, general anxiety disorder, when a person feels anxious all the time in day to day situation, and is always preoccupied with the feeling as what is going to happen in the future, it is called as generalized anxiety disorder. General specific phobia is about heights, or about people, or being enclosed in small spaces, uh, or about certain animals. Like there could be people who would be have become anxious or fearful of say lizards or cockroaches. So those are called as specific phobias. Or in specific situations like exam phobia. OCD is again another type of anxiety disorder in which people have repetitive thoughts and repetitive behaviors like washing hands, or checking bolts, or checking gas whether they have switched it off or not. So these all different presentations of anxiety are classified under anxiety disorders in DSM-4 and in ICD-10. There are various symptoms of anxiety like racing heartbeat, or sweating, or feeling of doom, something is going to happen, dizziness, giddiness, discomfort in the chest, abdominal pain. So these kind of symptoms are presented usually when a person becomes anxious. There is another thing which is called as panic attack or panic disorder, in which a person feels very anxious